You would want to freeze eggs
Yeah.
with the knowledge that you're going to use these eggs,
Okay.
which means you wouldn't want to freeze eggs at a very young age unless you have a medical reason to do so.
Mm.
You don't want to freeze eggs at a very old age either, because the
Yeah.
quality of these eggs will not be as good.
Everyone, welcome back to another episode. If this is the first time you're joining us, make sure you press the subscribe button and to follow us on our Instagram at Catherine.fertilitydietitian. Today, we dive deep into the topics that's been making the headlines and also changing the conversations around women's reproductive choices, which is egg freezing. And we are so privileged to have Dr. Joseph Jabbo joining us today to share with us his expertise on egg freezing. Now, Dr. Jabbo is the leading gynecologist and fertility specialist from Brisbane prestigious Sunnybank Women's Centre and a valued member of the Monash IVF network. Hello, Dr. Jabbo. Thank you so much for joining us today.
Thanks, Catherine. Thank you for having me on your YouTube channel and Instagram. I'm looking forward to having a good chat with you.
No worries. I'm super excited here. So shall we start with the basics, Dr. Jabbo? So can you tell our audience what exactly is egg freezing and why is it becoming a popular option for many women?
So egg freezing is the process with which you stimulate a woman's ovaries to produce multiple follicles. And then what you do is you do a minor procedure where you extract these eggs from the follicles and you can freeze them for the future. Historically, egg freezing was mainly done for medical reasons. So if a woman has severe endometriosis and her egg reserve is low, then you can potentially freeze her eggs for the future. If a woman is going to go through a cancer treatment or she requires the removal of her ovaries, for whether it's for ovarian cancer or any other reason, we used to do a lot of egg freezing for that reason, so that you can conserve a woman's fertility and she can conceive using her own eggs in the future. Now, over the past few years, and especially since, I suspect since 2019, we've started doing more and more social egg freezing. Now, social egg freezing is where there is no medical reason per se to freeze eggs, but a woman can choose to freeze her own eggs in case she wants to delay conception to the future. So, for example, a lot of women these days are delaying their plans to start a family to later age. And we know that after the age of 37, a woman's egg quality starts deteriorating. So if she freezes eggs at a much younger age, she has a better chance of conceiving in the future by using these eggs. So women are getting more educated these days. They're going to university, they're traveling the world. Instead of conceiving at the age of 22, 23, 24, 25, we're seeing many more women trying to conceive at the age of 37, 38, 39. And we know for a fact that conception at that stage of a woman's life can be a little bit more difficult and challenging. And if she has eggs frozen at a younger age, she can use those eggs and hopefully conceive with her own eggs.
Yeah, fascinating. In fact, many of our viewers actually ask these questions about the age. So in your opinion, what's the typical age range of women should start considering, egg freezing? And is there a best age to consider for this option?
Okay, so that's a very good question. You would want to freeze eggs with the knowledge that you're going to use these eggs.
Okay.
Which means you wouldn't want to freeze eggs at a very young age unless you have a medical reason to do so. You don't want to freeze eggs at a very old age either, because the quality of these eggs will not be as good. The best time to freeze eggs is between the age of 30 and 37. Okay, so this is the time when a woman is most likely to use her eggs. And this is when the quality of the eggs is still at a good level. So, for example, women that will try to conceive using their eggs at the age of 30 would need about 10 to 15 eggs. And the number of eggs that they need to freeze will increase with their age. Now, I still get women who come to me at the age of 40, 41, still planning to conserve their fertility, we still move forward with freezing their eggs, with the knowledge that, number one, the success rate using the frozen eggs is much lower, and number two, that potentially they will require multiple cycles to freeze more eggs so that they have a better chance of conceiving in the future.
Wow, that's a valuable insight there. So another debate I often say online as well around the efficacy of the frozen eggs. Could you shed some lights on, in terms of pregnancy success rate, is there a difference using frozen eggs versus fresh eggs in IVF?
So fresh is always best, without a doubt. So using fresh eggs has about a 20% higher success rate than using frozen eggs. That being said, it is also very much age related. So if a woman freezes her eggs at a much younger age, she has a much better chance of conceiving using them in the future. So the rule of thumb is 20% is the difference between frozen eggs and fresh eggs, and very much age related. So for a woman aged 30, for example, she has about a 50% chance of conception using eggs. It's much lower as her age progresses.
Wow, that's great to know. So what would you be, suggesting to our audience here who might be considering egg freezing at this stage? What is the very first step that should take?
So I think, well, there are different avenues to proceed with this. So a consultation with a general practitioner would be suitable, just to check their baseline blood tests and baseline pelvic ultrasound scan to get a bit of an idea about where they're at. They can get a blood test checking their egg reserve, and this is called the anti-Müllerian hormone. Another avenue is making contact with the Monash IVF nurse, which is the company that I work with. It's a free online chat they can have with the nurse. They can direct them in the right direction. Following this, it's probably best to touch base with a fertility specialist such as myself. I can then take them through the whole process from start to finish, and that would be the first step.
Yeah, wonderful. And I'm curious, Dr. Jabor, are there any specific dietary changes or lifestyle recommendation you would suggest to help to maximize the egg quality or egg health?
That's a very good question, and one that's pertaining to your field. I'm not an expert with diet, so I tend to refer patients to you, obviously. I have a broad knowledge about what we need to do. So essentially, the most crucial thing is to maintain a healthy diet. I always recommend something along the lines of a Mediterranean diet. The meal plans and so forth and so on are usually organized by yourself. And then in terms of things for egg quality, obviously, don't smoke, don't drink alcohol, avoid processed food. There are certain supplements that one can take to improve quality of eggs. And that's something that I discuss with my patients as well. And sometimes we can prescribe these medications, especially for women who are a bit older and who may have issues with their egg quality. But in general, it's a Mediterranean diet, high in olive oil and things that contain omega-3, such as fish, lean meats, lots of veggies, lots of fruits, and just avoidance of processed food. It's what I usually recommend, and then I send them off to you, Catherine.
Thank you. I really appreciate all your support here. But great advice, Dr. Jabor. I couldn't agree more. It's pretty much the same thing that I would advise to all clients as well. I have one final question for you, Dr. Jabor. Where do you see the future of egg freezing and the wider sphere of fertility treatments in the future for all of us?
Well, there's a lot of things that we're looking forward to in the future. So in terms of the politics of it, we're looking forward to hopefully getting more Medicare rebate for social egg freezing as opposed to just medical egg freezing. Hopefully that'll be something the government can look at in the future. In terms of the egg freezing process itself, At the moment, we're only able to freeze mature eggs, and sometimes you can actually retrieve immature eggs at the same time that you're retrieving mature ones. I mean, the technology and the ability to be able to utilize immature eggs is the next frontier. I mean, we're already looking at this, but I'm hoping that we can get this in the pipelines very soon as well.
Yeah.
In terms of the broad IVF, there's a lot of, I mean, this is a field that is, 60, 70 years old. It's a consistently new technologies are coming up.
Yeah.
So, the most important thing is being able to get good success rates, and a lot of that is based in the lab. So, for example, at Monash IVF, we have some of the best science in the world. We have multiple embryoscopes. We have very good scientists. So the ratio of embryos to scientists is what is really important as well. We have a very high ratio of scientists to embryos being looked after. And the same goes with the nurses that we work with. Ultimately, the thing that would be best is how we can retrieve eggs from ovarian tissue without having to stimulate a woman with FSH injections. That would be the next best thing, where a woman doesn't have to subject herself to multiple needles and so forth, so on, and you can just retrieve immature eggs from antral follicles without having to stimulate their ovaries. I mean, that would be the next great thing. I suspect we're slowly getting to that.
That's fascinating. And Dr. Jabal, well, thank you so much for your time today. It's been an absolute pleasure. I'm sure that your insights have definitely shed some light on these very important topics for many of our audience here. So for our viewers who are interested in booking a consultation with you, could you share where can they find you?
So at the moment, I'm located in Sunnybank in Brisbane. I see patients from all over, though. We are in the process of moving our clinic closer to Greenslopes as well, and we'll share the details of my new clinic in the coming weeks.
Yeah.
So my current clinic is called Sunnybank Center for Women. I also work with Monash IVF. I utilize their lab to do my IVF treatment. And I also consult out of Spring Hill. So the clinic is located in Spring Hill, 55 Little Edward Street. So if patients want to see me, I would recommend that they touch base with their GP. They can get a referral, and then I'll see them, and we can take it from there.
Sure. And I know you have an Instagram account. Am I right? What's your Instagram handle? Did you want to share with us as well?
Yes, that's Dr. Joseph Jabour. So they can easily locate me with that.
Yeah, and follow some of the behind the scenes of Dr. Jabour's life. Beautiful, and I'll surely attach all your details in the description box below. Well, once again, Dr. Jabour, thank you so much for joining our channel. And for everyone tuning in today, if you have more questions or thoughts on these topics, make sure you leave a comment below comment box. And don't forget to like, share, and subscribe to our channel. And once again, take care, and I'll see you next time. Bye for now.